morning, everyone present here from Malawi. I hope you all are doing well. My name is Rasha and I represent Merck Foundation. A very warm welcome to everyone present here on behalf of Merck Foundation. Thank you for joining us today for the Merck Foundation Health Media Training Malawi in partnership with Her Excellency Mrs. Monica Chakwera, the First Lady of the Republic of Malawi and Ambassador of Merck Foundation More Than a Mother campaign and Media Council of Malawi. Today's health media training is chaired by Senator Dr. Rasha Kelej, CEO of Merck Foundation and President of Merck More Than a Mother campaign. I would like to welcome our guests, speakers, and media representatives who have joined us today. We have a very exciting agenda for you all. We will have talks from eminent medical experts who will be addressing various health and social issues. We have a media expert who will highlight the role media plays to raise awareness about sensitive health and social issues. We also have some very exciting announcements. So stay tuned and get ready to sail through the knowledgeable journey with us at the Merck Foundation Health Media Training in partnership with Her Excellency Mrs. Monica Chakwera, the First Lady of the Republic of Malawi and Ambassador of Merck Foundation More Than a Mother campaign and Media Council of Malawi. To give you a glimpse of the kind of work we do at Merck Foundation, we would like you to watch Jacqueline's video.
Jacqueline Wende, a 27-year-old young woman from a rural place called Masii in Machakos County, Kenya, tells us her sad story of having both hands chopped off, not by thieves, but by her own husband, for failing to conceive, even though he was the one with a fertility problem.
Mali ndio nilisikia akigonga mlango akiniambia Jackie nifungulie. Niliachana na chakula nilikuwa nakula, nikaamka nikaenda nikamfungulia. Kitambo nimfungulie ndio alikata hii mkono. Nikaanguka hapo chini na akanifuruta nikaenda nikaanguka huko chini. Kitambo nianguka huko chini alikuwa ananikata kichwa na mikono na uso na akanidunga hapa na kisu na hiyo panga alikuwa nayo. Aliponichapa nilimuuliza, kwa nini ngila unanichapa? Utaniua peke yako. Akanyamaza akaniambia, leo ndio siku yako ya kuongea, hautaongea tena maishani.
Merck Foundation came to the aid of Jacqueline through the Merck More Than a Mother campaign. She was provided with a new home and a supermarket to enable her to earn a steady income and become independent. Like Jacqueline, there are many other women that suffer from infertility stigma. Merck Foundation works closely with partners to empower them to be heroines of More Than a Mother movement.
Jacqueline, I want to know that you are my sister. As long as I exist in this world, on earth, my fate is connected to you.
Yes.
So you have to understand this. You come back to me in anything, I will always be there for you and my room is there. So I'm coming.
Modi Banji, Malawi, and very happy to be with you today for our first health media training we do in Malawi in 2023. This is really very important for us. We do this health media training in partnership with First Lady of Malawi and my dear sister and ambassador of Merck Foundation, More Than a Mother campaign. Her Excellency Mrs. Monica Shakwira, and I'm very, very glad that we are working closely together and we have done great things in very short time. Knowing that we know each other, as you know, during Corona, and we met online. We started our programs, and in a very short time, we have introduced a lot of programs that is close to my heart and to her heart. And this was the Educating Linda program. We have provided scholarships for 40 girls in Malawi to complete their education, and it's very much important because this is to empower them to reach their potential and fulfill their dreams. And of course, not only that, but you know how many scholarships we have provided till today in a very short time. It is 33 scholarships to young Malawian doctors in 32 critical and underserved specialties. Most importantly, fertility, embryology, sexual and reproductive care, diabetes, cardiovascular preventive, respiratory care, acute care, and endocrinology, and oncology. And there is extension for more specialties like pediatric, internal medicine. Also we have in internal medicine, we have in pediatric emergency and advanced surgery, and many other specialties that are going to be introduced also to transform public healthcare sectors. Together with Her Excellency the First Lady of Malawi, Ministry of Health of Malawi, we had made a transformation in public healthcare sector, and we also made history because there was as a first specialist in many specialties in public sector in Malawi that we trained through our scholarships, through Merck Foundation scholarships. But very important for you also that this media training that we are doing, and I am looking forward to see you and meet you all in person when I come to Malawi, and I'm planning to come this year in 2023 as well. But also the awards, the 8 awards that we announced last year and year before, and this year as well, it will be about More Than a Mother Awards, Fashion Award, Media Recognition Award, Film Awards, and Song Awards. And these awards to you to address, and through your work and through the media coverage, either online or TV or radio or print, how to empower infertile women, how to break infertility stigma, how to sensitize the communities about raising awareness about male infertility, knowing that the cause of infertility is 50% for women, 50% for men, caused by men. So why then women are the only one to be blamed for delay of having a child, although it takes a man and a woman to have a child, and 50%, as we said, scientifically caused by male infertility. So we here together through media, we want to break the silence, we want to break the stigma, we want to sensitize the community and be the voice of the voiceless, and encourage men to speak about their infertility and address it openly. Join the wives to go to test it and go to treatment and to have a happy family. Join her to happy family journey, to make a happy family together, because it takes a man to have a child. And let us empower women and support them and end this discrimination. end this violence, the physical or psychological violence that they are suffer, either from their husband or from society or from their mother-in-law or sister-in-law. So we need together, through community awareness, through your work in the media, to talk about this, give stories of women, read about them, what is scientific sessions that we are going to tell you, to give them scientific facts, and also say no taboo. Fertility is not a taboo. It's not a stigma. It's a condition, can be prevented, can be managed, can be treated. And women are more than just mothers, and men are more than just fathers. We have always to say that to them in the media. You are more than mothers, you are more than fathers. So what about even if you don't have children? What will happen? You should have a purpose in life. There's a lot of things that you can do to add value to your society and your community. So, but not only actually we are going to talk about infertility, but we're also talking about things that I believe and I sure that it contribute to the lack of information that can cause infertility, like girls' education, child marriage. And we have to support girl education. We have to stop child marriage, FGM, gender-based violence, all these things that we need to address as well through our work and through our community awareness in our outlets, either TV, radio, print, or online. So therefore, we are going to talk about this now as well. And you remember in 2022, we had awards announced to address also raising awareness about prevention and early detection of diabetes and hypertension. We are going to announce the winners very soon, maybe in February, but very soon, maybe. Yes, but also we are announced the call for application, that new one for this year 2023, which I would like to remind you about it, that please apply with all your work, not only one work but frequent work, so you can contribute to this cause through your valuable work, and also have opportunity to win. Which is a very prestigious also award, which is in partnership with Her Excellency the First Lady of Malawi, Mrs. Monica. So this is very important as well. What else we have done together in addition to this? Scholarships for doctors, scholarships for girls, awards for media, musicians, artists, to raise awareness about different topics in the community and health and social issues in the community. We have done our Africa TV show. Merck Foundation have done our Africa TV show. We are looking forward to broadcast it in Malawian TV as well, so you can enjoy it. We are in the way to talk to people about this. But this TV show address all these topics through fashion and art with purpose from across Africa. And we will continue to do so in a very colorful and bright way. You can see actually the TV show in our social media, Merck Foundation, or my own social media, Rasha Kelej, called Our Africa by Merck Foundation TV show, which is very, very, very attractive, beneficial, and add a lot of value to a community, children, young people who's very busy, and you need to just deliver the message to them in a very easy, simple, and colorful way, and attractive way. But we also did storybooks, 8 storybooks about girls' education, about infertility stigma, about Right into the Future, all again girls' education, Rescue Jacqueline, about ending child marriage, Not Who You Are, about stopping gender-based violence, Jude Sugar Free, about diabetes, and Mark Office, I think, I don't remember the name very well now, but it's about also hypertension, early detection and prevention. All these children's storybook, it's released and been distributed, copies of them, and the rest will come soon by Her Excellency First Lady of Malawi office on children and schools, and to start establish their character and persona since from young age, which is very, very important. And this is where we create a culture shift. These stories also, it would be nice that you can put it on your website or talk about it in your outlets and TV or radio. We also done very important songs, which you will hear to one of these songs today, which is about reverse diabetes, stop diabetes. It's about raising awareness and prevention about diabetes. Very, very important. I would like to have this song as a national song for Diabetes Day and normal days, because it sensitized the community in a very valuable way, I believe. It's been sung by Kwesi, singer from Ghana, and I would like to also one day to collaborate with a singer from Malawi. Maybe you connect me after the meeting with a singer from Malawi to do also nice songs about raising awareness about different topics. Of course, if you go to our social media, you will see the other songs about even raising awareness about corona, about educating girls, gender-based violence. A very nice song that you like very much from Kenneth. He is Ugandan singer, and also a song about education, 1, 2, 3 ABC by Namibian singer Shanke. So it's a lot. Even in Portuguese and French, we have songs. So I believe very much in art, as you know, and media, and I believe that they can contribute and be a critical partner to raise awareness in different community. So together with you, media partners, and of course the doctors that we trained, we can create a culture shift, and we can make a transformation in patient care in general for the patients and their families and their communities. So I wish you to very much to enjoy and benefit from our media health training in partnership with Her Excellency, the First Lady of Malawi. Please enjoy it and benefit from it, and I would like to see your application for the 2023 award, Media Recognition Award about More Than a Mother Award, and also the Healthy Lifestyle Awards. So bye-bye, and looking forward to see you in person in Malawi in 2023.
Before we start with the speakers, I would like you all to watch the promo of Our Africa by Merck Foundation TV program. Our Africa by Merck Foundation is a pan-African TV program that is conceptualized, produced, directed, and co-hosted by Senator Dr. Rasha Kelej. As mentioned by Dr. Rasha, the program features African fashion designers, singers, and prominent experts from various domains with the aim to address and raise awareness on sensitive health and social issues such as breaking infertility stigma, importance of early detection and prevention of diabetes, and many such issues. With this TV program, we are aiming to create a cultural shift across Africa.
Senator Dr. Rasha Kelej, and creator of Our Africa TV show.
All Africa will be part of our show.
The CEO of Merck Foundation.
We want to support girls' education. No to infertility stigma, yes to girls' education. We want to stop gender-based violence for stop. Number of child marriage will double by 2050.
Good morning, everyone. As rightly said, I am Dr. Martha Masamba from the Kamuzu University of Health Sciences. I'll take you through a talk entitled Infertility Prevention, and also looking at the link between infertility and infectious diseases. And we will talk about male infertility. As we know, we can't talk about fertility without the involvement of men. So just an outline of the talk. We will look at prevention of infertility, and then we'll talk about the link between infertility and infectious diseases, as well as talk about male infertility. We aim to break the stigma around infertility in Africa through the Merck Foundation More Than a Mother program, which is headed by Senator Dr. Rasha Kelej, who has rightly said a lot about this program in the introduction. So let's look into infertility awareness and prevention. If we get back home in Africa, we know there are a number of factors that result in higher prevalences or higher occurrences of infertility. If we compare the rates of infertility in this part of the world and compare that to the developed world, you will find that our rates are more than double those in the developed world. And most of the causes of infertility in this part of the world is really from preventable causes in women as well as men. And some of these factors that contribute to these high levels of infertility include some traditional, cultural, and religious practices, as well as the fact that we live in a low resource environment. So given that we live in a low resource environment, poor nutrition and malnutrition is rampant. And this can either be from over eating or under eating. You will appreciate that in some countries in Africa, the junk foods are cheaper than you finding proper nutritious food. So then people tend to eat the junk food and therefore become obese. But on the other end, you've got also scarcity of food, which is maybe the more common aspect in our environment in Malawi. And again, undernutrition results in higher levels of malnutrition because of the poor development that results from this. Other factors include untreated sexually transmitted diseases, and this is because of the scarcity and unavailability of resources, but also the stigma that is associated with these diseases. People would prefer to rather stay alone, or they will get ineffective treatment. Unsafe abortions do contribute to infertility. This can be either from the complications that arise, but also infections that can arise due to the unsafe abortions. Female genital mutilation, this may not be a big problem in Malawi, but in some cultures, this is a big problem. And also exposure to smoking. This can be smoking from tobacco as well as from charcoal or firewood, especially if used in closed spaces. Other toxins from leaded petrol and environmental pollutants alike. So as I mentioned in the previous slide, infection is the cause of infertility in up to 85% of women in sub-Saharan Africa, compared to only a third in the rest of the world. And it is important to raise awareness to let women to get regular checkups. If they feel unwell, they've got an abnormal discharge, they're having abdominal pain, they should really seek medical care early. The earlier the infection is treated, usually the damage is minimized or eliminated completely. Now, just still on the infection prevention and prevention of infertility in women, we know that the commonest infections that lead to infertility in women is chlamydia and gonorrhea. These are bacterial infections that basically are sexually transmitted. The way they lead to infertility is by blockage of the fallopian tubes. These are the tubes that get the egg from the ovary once it's been released and transport it. And it's also the site where fertilization takes place. So unfortunately, the chlamydia and gonorrhea infections have got very few or completely no symptoms at all. So women can get this infection and not feel sick at all. But the bacteria still continues to cause damage inside. And if this is not treated, then the pelvic inflammatory disease develops. And this is where the womb, as well as the fallopian tubes and the ovaries, then become inflamed. In severe cases, then you have pus developing, and sometimes then they will get very sick from it. And in the worst case scenarios, they may even end up with having the ovaries or the tubes, or including the womb removed. And if this is the case, then we know that this woman will never be able to conceive or have children of her own. Another common infection in our setup is HIV. I'm sure by now we all know what HIV is, and we know it does impact on the body's immunity. Besides this impact it has on the body's immunity, unfortunately, HIV also is a risk factor for pelvic inflammatory disease. As you all know, HIV is sexually transmitted. And so people who have contracted HIV are most likely would have also contracted the other sexually transmitted bacteria. But also in the situation where the HIV is not treated, the patients become ill. And that illness that may result in weight loss as well as stress does have a negative impact also on the fertility of the patient. HIV can also affect the body's ability to produce hormones which are required for ovulation, and therefore then this becomes a problem for the woman to get pregnant. So having said that, it is important that we educate the masses about safe sex, and this should be a responsibility for both men and women. And avoiding risky behavior such as having multiple sexual partners. This will reduce the occurrence of sexually transmitted infections that will then lead to infertility. And we know that even for the men, apart from the women getting pelvic inflammatory disease, these infections can also cause inflammation in the genital organs, especially the testicles in men. And this then in the long term does impede the production of sperms. And so this can cause infertility in the long run. Now, what strategies can we use to help reduce the occurrence of infertility? So number one is exercise, and we are talking about moderate exercise. So in life, we know that too little and too much of anything is really dangerous. So even the exercise, when it comes too much, if it's excessive, it can actually cause infertility instead of improving the fertility. So it's important to provide this information to the masses, that women should exercise regularly, moderately. So an example of moderate exercise would be brisk walking for about 30 minutes, maybe 3 times a week. Besides the exercising, this must go hand in hand with eating a balanced diet. And we know it doesn't make sense you go and exercise, you come back home and then you eat a whole plate of fried chips, and then you expect that you are going to maintain a healthy weight. So it's important to balance up the exercise along with the diet. And this is really to make sure that you don't become underweight. That is if you are eating not enough. but also on the other hand, you should not be overweight. So maintaining a good weight is the key here. Other strategies, we know, as we said, smoking does have a detrimental effect on the fertility. So women should be encouraged to stop smoking if they are trying to fall pregnant. But also just in general health, smoking we know has got dangerous effects on their health, and it's better to completely avoid smoking. And for those that take alcohol, the same, it's advisable to stop alcohol and any illicit drug use, so that these substances do not prevent or impair one's ability to conceive. One other strategy is also to limit caffeine. We know caffeine does have an effect. It can impair the chances to conceive, but also has got detrimental effects if someone gets pregnant. The recommendation is to limit caffeine to 200 milligrams per day, and that equates to 1 cup of coffee in a day. And women should be advised accordingly. And other industrial as well as environmental toxins such as pesticides and heavy metals, it's important to educate the masses if they are going to be in contact with these, maybe wear appropriate protective gear. And also some large fish that contain heavy metals such as lead should be avoided. And also strategies to avoid or reduce stress, whether this be at work or at home. And one such strategy is the exercise we talked about. So when you exercise, your levels of stress do reduce. So you kind of like benefiting in so many ways by exercising regularly. Now we've talked about the female, but we know there's not going to be a pregnancy if there's no man. So we need also to raise awareness about male infertility. So we know that there's not going to be childbearing without a man, and this is accepted as a fact. However, we have chosen maybe to neglect the fact that just as the men are called to childbearing, they are also called to the infertility problem. So actually, when you look into the literature, if you had 100 couples that have got an infertility problem, 30% will be infertile because it's the man that has got a problem, and the other maybe 40% is the woman. But then in the other 1/3, it's actually a combined problem with where both the man and the woman have got a problem. So it is important that the men also get to be involved in issues to do with infertility, and encourage them to share the treatment journey with their partners. Infertility is one of the commonest conditions affecting people of reproductive age between the ages of 20 and 45 years. It's important that as couples seek fertility treatment, both partners should be evaluated together. And some of the problems that might lead into male infertility include physical defects such as blockage of the tubes that transport sperms, but also this blockage can be either born with, which is called congenital, or acquired, where this develops when the person is growing up. And one such cause of the acquired blockage is infection. And also physiological, this is where there is failed function, such as where the hormones are not adequate in the body to allow for formation of sperms and sexual function. And also environmental influences, just as we talked about in the female side, drugs, alcohol, industrial toxins, but also on top of that, for the male, excessive temperatures to the testicles can cause damage and impair the formation of sperms. Also, just like with the female, dietary factors and weight. So being overweight or being underweight is not good for fertility functions. So what strategies then can be used for the men to prevent infertility? So keeping healthy and avoiding the environmental toxins will go a long way to help reduce the problem of infertility. So limiting alcohol intake, just like we said in the women, avoiding drugs and stopping smoking. And this should be taken as a shared responsibility for both the male and the female. Also, men should avoid high temperatures to the testicles, as this can affect sperm production and motility. So hot baths, hot tubs, and also riding motorbikes for a long time. Just like in the women, exercising regularly, moderately is important, and avoiding exposure to industrial as well as environmental toxins. So wearing protective gear where this cannot be avoided is important. We cannot overemphasize the importance of eating a balanced diet and maintaining a healthy weight. As we know, obesity is directly related to testosterone levels, and we know testosterone is the main hormone in the male that is responsible for sperm production. The other advantage of eating a balanced diet is that a good diet provides the necessary nutrients to make sure that sperm function is maximized, and also to minimize the effects of factors which may otherwise damage the sperm. So you eat healthy, then even the sperms are going to be healthy. So I'll take you through some key take-home messages from this talk. Number one, infertility is not a stigma. We should really raise awareness that people that are suffering from infertility should not be stigmatized against. Yeah, so the other point, the other take-home message is that infertility affects men and women equally, and so the blame should not be left to the women alone. People need the information. We can talk about all this, but if this information is not taken across to the communities, then the stigma is going to continue. The women will continue to be stigmatized regardless of the causes of the infertility. So men need to be advised and encouraged to support their partners when they are seeking fertility care. Fertility is a shared responsibility. And we know that it takes a man and a woman to have a child, and therefore this is not just the woman's responsibility. Importantly, it's to realize that we are human beings, whether we have children or not. Men are more than fathers, and women are more than mothers. They should be accepted as such. So as we aim to break the stigma around infertility in Africa, we must say no to infertility stigma, and we must include men in the fight against the infertility stigma. So the purpose of Merck Foundation More Than a Mother is to create a cultural shift, to say no to the infertility stigma that is so rampant in our community, as we have seen in the story about Jacqueline. And so we want, at the end of the day, to have a continent where there is no stigma around infertility for both men and women. And we know that men too can suffer social pressure due to infertility. And so they can also be the cause of infertility, and they can suffer the infertility stigma. So men should not be left out in the whole campaign as we fight the stigma to infertility. we can do this together. It's not one person's responsibility. The media is very crucial in this, as they have got more contact with the masses. Clinicians on our part, we see one-on-one, we send out the message, but I think together as a community, we can create a culture shift where people that are suffering from infertility can be accepted as they are. I thank you all for your attention.
So I thank the Merck Foundation for giving me this platform today to shed some light on the following topics that Alisha already mentioned. And I'm Dr. Janine Danyamar, and Dr. Marta already shared some valuable information about the links between infertility and infectious diseases. So I'll be talking mostly on the social and psychological impact of infertility and other gender-based on the social issues like GBV, child marriage, and FMG. So infertility is defined as the inability to achieve clinical pregnancy after 12 months of regular unprotected sex. Unfortunately, it is a global public health problem with about 20 to 30% in some parts of Africa, varying from region to another, even within the same country. It can greatly affect our mental health, leading to psychological distress and various mental health problems. Stigma related to infertility is a public health issue. In societies where gender roles and social status are intrinsically linked to parenthood, these consequences are intensified. So, why is infertility stigmatized? Sorry. Stigma, it is defined as a negative feeling of being different from others in the society and being contrary to the social norms. The stigma of infertility is a phenomenon associated with various psychological and social tensions, especially for women. Society expects a couple to start a family planning after they get married. So a few years after the marriage, if the couple doesn't have a child, the family doesn't have a child in the family, so the society starts to judge the family. Infertility is still considered a taboo in some parts of the world. However, the many modern medical advances have greatly helped in terms of fertility. Unfortunately, more than 70 million couples suffer from infertility worldwide. Infertile women suffer the negative consequences of infertility to a higher degree in developing countries rather than in the developed countries. Globally, infertility creates problems for couples, especially for the women who are usually held responsible for the couple's infertility and suffer from personal grief, frustration, social and psychological stigma, rejection, and severe economic deprivation. Remember also that men and women are also equally responsible for infertility. Yet, the burden often falls solely on the woman, especially in developing countries. So there is a vicious circle for the stigma of infertility. How the woman feels when she's bearing the stigma of infertility. There's a feeling of shame, guilt, and secrecy. There's also lack of social support, feelings of emotions of depression, anxiety, and stress, which can lead to not only problems in the relationship, also self-esteem, but also can lead to alcohol or drug abuse. So now I'll shift to another topic, gender-based violence. Gender-based violence or violence against women and girls is a global pandemic that affects 1 in 3 women in their lifetime. Women and men experience gender-based violence, but the majority of victims are women and girls. Based on gender inequality, the abuse of power and harmful norms are present. More than 35% of women worldwide have experienced physical sexual violence between their intimate partners or non-spousal sexual violence. Overall, 7% of women were sexually assaulted by someone or other than a partner. Worldwide, up to 38% of women's murders are committed by an intimate partner. 200 million women experience female genital mutilation or cutting. This has been in the global pandemic. So what are the forms of gender-based violence that we can see nowadays? And it is unfortunately still prevailing. There is child marriage, female genital mutilation, honor killings, trafficking for sexual purposes or slavery, domestic violence, physical punishment, sexual, emotional, or psychological abuse. So what is child marriage? While the prevalence of child marriage has declined globally, previously it was 1 in 4 girls, now it is 1 in 5. That it is prevalent among the practice is still widespread. So childhood devastation, restriction of personal freedom, domestic violence, illiteracy, teenage pregnancy, psychological distress, lack of freedom of decision, sexually transmitted diseases, emotional violence, increased suicide rate are some of the harmful effects of child marriage. Unsustainable development goals call for global action to end human rights violation by 2030. Female genital mutilation. It involves the partial or total removal of the external female genitalia or other damage to the female genitalia for non-medical reasons. This practice has no benefit to the health of girls and women, as people think that it is beneficial. Female genital mutilation can cause severe bleeding and urination problem. Later, cysts, infections as well as complications during childbirth and an increased risk of newborn death can be present. Female genital mutilation has no health benefits and often has long-term physical and psychological consequences. Medical complications can include severe pain, prolonged bleeding, infections, infertility, and even death. It can also lead to an increased risk of HIV transmission among these patients. Women who have undergone female genital mutilation may experience complications during childbirth, for example, postpartum hemorrhage, death, and early neonatal death. Unfortunately, depression and suicidal ideations are very common in these cases. So, about the social and psychological stigma. Oppressive and discriminatory attitudes emanating from both the family and the society at large cause mental and emotional trauma, which can have lasting psychological repercussions on the woman. Infertile women who have a low social support, not only from their partner but also from the family and the friends and the society, they have a strong socio-cultural pressure to have children. They have inadequate coping. For example, they are emotionally focused or they have avoidance, previous trauma, or mental health conditions that are already present, and overly involved family members, which can be seen in many cases, are particularly at risk of a psychological distress, including depression, and anxiety. This can very often lead to separation or divorce, and the man is encouraged to find another woman whom he thinks could conceive. This is unfortunately very common in many societies. Anger, frustration, low self-esteem, financial hardship, and lack of social support in case of infertility and gender-based violence can contribute to problems such as alcohol or drug addiction. Several studies have shown that couples with infertility problems reduce social interaction, especially with pregnant women and friends who have children. Also, couples experience stigma, feelings of loss of identity, and failure as part of their infertility. Both women and men experience pronounced feeling of defect and incompetence. Another study demonstrated that men from couples who fail to achieve pregnancy despite treatment will experience negative feelings such as frustration and disappointment caused mainly by prolonged efforts in terms of medication and expensive treatment costs. Few countries offer insurance coverage for infertility treatment. The range of coverage of the treatment varies, but it is not 100% effective. Therefore, the cost of infertility treatment is very high. Treatment failure can be a cause of immense stress and depression among these couples. What are the feelings and emotions of these couples? They have difficulty concentrating, intrusive thoughts, recurring nightmares, irritability, sleep disturbances, flashbacks, detachment, avoidance, depression, and anxiety are very common in people with gender-based violence and infertility. The risk of depression and post-traumatic stress disorder, substance abuse, or suicide is much higher among victims of gender-based violence. Female genital mutilation can be an extremely traumatic experience that can cause emotional difficulties throughout the person's life, including depression, anxiety, PTSD, nightmares, and other sleep problems. 80% of female genital mutilation victims suffer from affective or mood disorders. Other psychological effects include emotional disbalance, distress, stress, anxiety, and depression. So, how to cope with the stigma? Psychological counseling has been shown to be beneficial throughout medical treatment and the therapeutic interventions. For example, cognitive behavioral therapy has shown favorable results in managing the emotional balance of the individual or the couple and reducing the risk of psychopathology. Fertility experts are increasingly aware of the importance of providing educational interventions to address patients' fear and concerns and to better prepare them for treatment requirements. Improving the quality of information provided to patients is one of the easiest ways to improve the patient experience. Patient-centered psychotherapy, infertility counseling, mindfulness practice, stress release, exercise, meditation, personal care are among some complementary and alternative options that they can use to cope with the stigma. So what is the role of the media in all this? The media are part of our lives and have a large influence on our society. The importance of media is increasing every day due to the great connectivity that exists all over the world. It is the media that can influence our society to create a cultural change. Just as we experienced the recent pandemic where all the information was passed on to the public The media has an important role to play in breaking the stigma of infertility and helping. As I was saying that just we have experienced the COVID pandemic recently, and the media had a great role in sharing the information, how to use, what to do, what not to do, and how to cope in this condition. For stigma also and infertility, the media has a great role in prevention of these. The media can also promote self-actualization, which is the full realization of one's potential and the full development of one's ability and appreciation of life. The role of the media is also to raise awareness of laws relating to the protection of women against domestic violence, sexual harassment, professional harassment, and mental harassment. The community itself does not have adequate knowledge of infertility and other social issues. It is the media that can raise awareness of these issues and make them understand that infertility affects both the partners, provide them with the correct information, and encourage them to seek help. These are the things that the media is doing already. So what more can be done by the media? The media can help to raise awareness of less prejudice against women who have these problems, and instead try to encourage them to come forward and ask for help. Refer the population to primary care centers, for example, local or community health centers. The media can convey this information through caricature, drama, sketches, short films. The media can also encourage people to adopt children. How? By interviewing people who have already adopted children, or they have become foster parents for some children. So the media will not only help those children without any parents, will also help to decrease the stigma, raising awareness of promising options for assisted reproductivity, raising awareness of women's empowerment, and promote women's health and education in an attempt to prevent gender-based violence, female genital mutilation, and ending child marriage. Lastly and most importantly, the media should encourage women to take care of their mental health, because as we have the saying that you cannot pour from an empty cup, so you have to take care of yourself first.
I hope you all are finding this training useful and learning something from Merck Foundation Health Media Training in partnership with Her Excellency, Mrs. Monica Chakwera, the First Lady of the Republic of Malawi and Ambassador of Merck Foundation More Than a Mother campaign and Media Council of Malawi. Before moving on to our next session, I would like you to watch a new song created towards addressing and raising awareness about diabetes and promoting a healthy lifestyle and saying goodbye to diabetes.
Merck Foundation. No more diabetes. Reverse diabetes. Goodbye diabetes. Can make it work. Can make it work. Can make it work. Can make it work. Push back diabetes. No more diabetes. Reverse it. Can make it work. Can make it work. Can make it work. Can make it work. Can do anything we put the mind to. The body exercise and put the smoking. No more alcohol. No more cigarettes. Skip the sugar drink. We can be sugar free. Better choices every day will make the difference. Exercise every day to make the difference. No more alcohol. No more cigarettes. Skip the sugar drink. We can be sugar free. Choose a better day plan. And quit the smoking. Say no more alcohol, no. Exercise every day. This fight is global. This enemy is vicious. But we can defeat it. If we make the choice, we can make it work. If we make the choice, we can make it work. Can do anything we put the mind to. Put the body exercise and put the smoke in. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. And our choices every day will make the difference. Exercise every day to make the difference. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. Choose a better day plan. And quit the smoking. Say no more alcohol, no. Exercise every day.
Thank you very much for this opportunity. First and foremost, I would like to acknowledge Her Excellency, the First Lady of the Republic of Malawi, who is also the ambassador of Merck Foundation More Than a Mother campaign and Media Council of Malawi, Ms. Monica Chakwera, and the CEO of Merck Foundation, Senator Dr. Rasha Kelej, all protocol observed. I will highlight an overview on the topics: promoting a healthy lifestyle, raising awareness about prevention and early detection of diabetes and hypertension, and how to report it to the community. Non-communicable diseases are conditions or diseases often of long duration and cannot be transmitted from one person to the next. In other words, they are not contagious. And these kind of diseases include cardiovascular disease and diabetes, cancer, as well as chronic lung diseases. And these result from a combination of genetic factors, physiological factors which relate to bodily functions, and exposures in the environment, as well as behavioral factors. In particular, harmful alcohol consumption, tobacco use, and physical inactivity. These are a leading cause of death worldwide, representing an emerging global health threat, with the World Health Organization saying 7 out of 10 deaths yearly are a result of non-communicable diseases. Thus, prevention by adopting a healthy lifestyle and increasing awareness and early detection by screening is the cornerstone to tackle NCD burden. The slide shown above depicts the main NCDs that account for the greater burden of illness and deaths. Today, we'll concentrate on the first two, which is high blood pressure and diabetes. High blood pressure, also termed hypertension. And according to the WHO 2020 country profile, 16% of Malawian adults between the ages of 18 and 69 have got hypertension, which accounted for about 1.3 million. That was in 2017. And unfortunately, about 93% of them were noted not to be under control in terms of the treatment that they were getting. And in terms of the diabetes burden, according to the IDF 2021 data, 7.3% of Malawians aged between 20 and 79 have diabetes, which represents a 2% increase from the 2011 figures. And this mirrors the trend which has been happening globally, where the burden of diabetes has been increasing. And this has been associated with a health-related expenditure. And it's projected that by 2045, there is going to be doubling of health expenditure by the Malawian people. So diabetes is long-standing health condition which is characterized by elevated levels of blood glucose, which leads over time to serious damage to the major organs, in particular the brain, the heart, the blood vessels, the eyes, the kidneys, and the nerves. And primarily, the problem is failure of the body to turn food that we take into energy. Most of the food that we eat is broken down to sugar or glucose. which enters the bloodstream, and then the body produces a messenger known as insulin, which acts as the key for the glucose in the bloodstream to enter the cells so that we can utilize that energy. In diabetes, the key is either absent or it fails to work properly. And the symptoms of diabetes will include excessive thirst, excessive appetite, excessive urination, known as polyuria. There is also unintentional weight loss and vision changes, as well as excessive fatigue. The following may mean you have diabetes. So these are some of the symptoms that one would look at. In addition to excessive thirst, tiredness, and urination, there is slow healing of cuts and wounds, there is constant hunger, and there is tingling feet and hands. And some would complain of sudden weight loss and blurring of vision. And these symptoms would prompt a visit or a consult of a healthcare provider. Diabetes has several types. In particular, we're going to highlight the 3 types of diabetes. And type 1 is also known as early onset. It essentially represents an absence of insulin, which we described as the messenger in the body. And the body so mistakenly attacks the part that produces insulin. And it accounts for about 5 to 10% of the cases of diabetes, with symptoms that tend to develop quickly and are seen at a younger age, and there is no preventative intervention. Whilst type 2, they do have insulin, but the insulin is usually not enough, or it's defective in terms of function, and it accounts for the bulk of diabetes, which is 90 to 95% of the cases, and it's usually seen in adults. And this one is preventable or delayed by addressing the risk factors that we are going to discuss on the next slide. And gestational diabetes is diabetes which starts when someone is pregnant. These are the risk factors that you tend to see with type 2 diabetes. And this can be divided into modifiable and non-modifiable. Modifiable, which means this can be addressed, like physical inactivity, being overweight, high blood pressure, high cholesterol, and smoking. For these, there is something we can do about them. And what is also of paramount importance when it comes to type 2 diabetes is that it passes through a preventative stage, which means it's something that we can actually prevent, which is called known as the pre-diabetic phase. Diabetes comes with a number of complications, and you'd find that there is a 2 to 4 times risk of heart disease or strokes in patients with diabetes, and this tends to occur at a younger age than those patients without diabetes. This risk can actually be lowered by addressing the lifestyle factors that we already alluded to. Diabetes is also a well-known cause of preventable loss of sight. So it's one of the things that we can actually work and try and reduce the risk of diabetic eye disease. Diabetes also affects the kidneys. 1 in 3 adults with diabetes are known to have long-standing kidney damage. And this increases the healthcare cost to the society, to the individual, and to the nation. And with diabetes, there is damage to the nerves, which leads to the tingling sensation and the numbness, such that minor injuries go unnoticed, and patients get diabetic foot disease, be it ulcerations, which might extend to the spectrum of bone infections with loss of limbs. Nutrition is a cornerstone when it comes to diabetes prevention and management, such that a balanced meal, which comprises of eating healthy foods in the right amount at the right time, is crucial to diabetes management. A good meal plan will essentially have more starchy vegetables, oil-based salad dressings, and whole foods with fruits and water, and less of the sugary juices or drinks. And you'd also find that in terms of the approach to diabetes, the simple method that you could use is what is called a plate method, where you visualize a circular plate and you say half of the plate will be non-starchy vegetables, and a quarter will be lean protein, be it fish, beans, and chicken, and the remaining quarter will constitute carbohydrate foods, in particular whole grains, potatoes, and pasta. In terms of diabetes prevention, maintenance of a healthy body weight is crucial, and this can be attained by a number of ways. And it's important to note that small weight losses, which range between 5 to 7%, have been noted to have a positive impact on health. And being physically active is one of them. And this would include regular physical activity, 30 minutes per day for 5 days. And it ranges from brisk walking and maintenance of a healthy diet, as well as avoidance of tobacco use, can also be part of preventative measures. In terms of hypertension, also known as the silent killer, is diagnosed if you've got two readings on 2 different days of at least 140 millimeters of mercury or more than 90 millimeters of mercury in terms of the diastolic blood pressure on both days. It is a condition in which the blood vessels have persistently raised pressures, and this leads to damage to the vessels, and it has also an impact in terms of the risk of strokes and heart attacks, like we described earlier on. The risk factors to hypertension do overlap. It's important to note that unhealthy diets, physical inactivity, tobacco consumption, and alcohol use, being overweight, are modifiable risk factors. For these ones, if we raise awareness, it means this can be addressed in the community and we reduce the risk of hypertension and the other non-communicable diseases. The non-modifiable risks are family history of hypertension, age over 65, and coexisting diseases such as diabetes or kidney disease. A person with high blood pressure tends to be asymptomatic. In other words, there are no symptoms that they complain of. And measuring blood pressure is the only way to diagnose high blood pressure. And when symptoms do occur, patients can come in with early morning headaches, nosebleeds, visual changes, or buzzing in the ears. And in severe cases of hypertension, they might present with vomiting, confusion, chest pains, and muscle tremors. Hypertension does have complications as well. And there is overlap in terms of the complications with diabetes. They do affect the eyes, the brain, where you can get strokes, heart attack, or you can get kidney damage. High blood pressure is preventable. There are measures to prevent high blood pressure, and these include reducing salt intake to less than 5 grams a day, eating fruits and vegetables regularly, and avoiding saturated fats and trans fat, avoiding tobacco use, reducing alcohol use, and being physically active every day. It also requires that one follows medical advice and adhere to lifestyle changes. They also need to be taking their medications as prescribed. And this is important because patients who've got hypertension, because they are asymptomatic, they don't get to see immediate perceived benefit from doing this. So they need to be aware that long-term use of medications is going to help them in the long run. They also need to get regular checks of their blood pressure. They also need to reduce and manage stresses. This brings us to the role of the media. The media provides an important link between the disadvantaged rural populace and the provision of the vital health information. The media also helps health workers expand their audience reach, and it's also important because it plays a major role in educating the public about health concerns. Thus, it brings clarity to the information that the public will get. It is also the responsibility to report accurate health and science information to the public. The media can also play a supplemental role by being integrated into a program that includes face-to-face or other forms of intervention. The media can be used at many levels of audience, organizations such as individual, network, organizational, or societal levels. And the goal is to enhance a state of well-being to guard healthy and the population at risk. Thank you.
Thank you so much, Alicia, and indeed, thanks so much, the Merck Foundation, the First Lady, and team at Media Council for working to put together this 2-hour chat with the media in Malawi, and I'm seeing more than 90 that have joined. I'm not so sure if everybody is still attentive. May I see thumbs up in the WhatsApp group just to be sure that we're not talking to robots? Let's see how many are still available. If you can just put up your thumbs in the chat, in the WhatsApp, that will be great. And great talk from a number of experts in the health sector that have taken us through wonderful presentations around the infertility and, of course, diabetes and so on. Yeah, so yes, I am the chairperson of the Media Council of Malawi, and I will discuss with colleagues, most of whom definitely we've interacted on the role of the media in reaching out to communities at grassroots levels, of course, raising awareness on health and social issues like infertility that we've heard from a number of health experts, inclusive of Dr. Masamba, our own, and of course, issues of girls' education, girl child, and GBV, and so on. I would want us to begin from this slide, a very critical slide when I talk about media role in raising awareness among various communities. So that's the kind of society that we're dealing with, a society that is variegated, a society that is not and should not be defined as general public, because the publics that we're dealing with are not in a monolithic kind of demographic. They are a society that require to be communicated in various ways to ensure that each one of them can understand a bit of what we want to share with them. When we start from this premise that these are not an audience that understand things in the same way, then we will be able to inform and educate them in a manner that will impact our society. So having said that, we need to understand that as media, we do not exist in a vacuum. We are a part of a larger society. And obviously, before becoming journalists, we were first and foremost part of such communities. And therefore, we need to be able to question ourselves, question the extent to which we understand the societies around us. When we get to that, then it becomes easier for us to understand the role that we have in ensuring that we are educating and informing the society, the communities we live in, the communities we work for, the communities we are talking to via our radio stations, newspapers, online, and so on and so forth. It's only when we know who we are talking to that we'll be able to have messages that will land on the audiences that are real and not only supposed, as it were. And so we have a role to shape the community narrative. And for us to be able to shape the community narrative on issues that we are discussing here, for example, infertility, we've all learned today that it's not only men, it's both males and females. If we are and we take up our pens and paper, begin talking to communities, first of all, understanding what it is that they believe in, we will then be able to say these things in the way that will recreate their beliefs, recreate that which they have believed in over the time. One thing that's usually a kind of a sickness among us in the media is to take scientific content and communicate it in as though we are scientists ourselves. That really has a huge negative impact in terms of what we are communicating with the masses. So we need to first of all, yes, accept that most of these things is science, but then we must make sure that we make them less scientific, because we are, as I said in the first slide, communicating with audiences that are largely non-scientific, people in the village, people, of course, peri-urban, people who are less educated, people who have never and will never get closer to science. So we need, when we have gotten this scientific knowledge, to be able to share with our masses in ways that will help them understand what these things are. And of course, we need to be able to share the alternative. When we have understood what they believe in, and we also have educated ourselves from the science, from the experts, we now need to be able to present the positives of looking at issues differently, and providing that, of course, via facts and evidence. It is only when we are able to tell the stories with facts, tell the stories with evidence, that people will be able to see why they need to begin looking at certain things differently. Unlike in the way that we've been cultured when we're down in the villages, the way we believe the causes of infertility, most of them not evidence-based, obviously, thinking that people were bewitched, maybe their parents were not faithful enough, and what have you. If we begin presenting evidence that which we have been believing is not true, and we provide facts of what is the truth, we will be presenting our roles in better ways that will help our society begin changing the way they look at things. So I'm saying you cannot do that if you're not knowledgeable yourself. So it is very critical, and thanks to this particular training today, it is very critical that we begin educating ourselves first. So as journalists, it is very critical and imperative that we always are seeking knowledge. Read, and read. Sometimes we present ourselves as jacks of all trades, but it is important to remember that we are experts of none of those trades. And this is why we always need to ensure that we're talking to experts, we're consulting experts to understand these things. I saw one comment in the chat where someone was asking for contacts for Dr. Masamba, so that we can be able to get these facts a little better at times, and then we are able to educate the masses in better ways. But when we are speaking to these experts, let's get the knowledge but avoid imitating them. Let's avoid presenting these things as if we are the Dr. Masambas. We are not. We are only the bridge, and therefore as a bridge, we should be able to provide that passing space that will suit all sizes of vehicles, all sizes of the audiences that we're dealing with, all types of people that we are speaking to, because we are not the medics ourselves. We are only that vehicle that is presenting a fact in ways that must be understood by everybody else who we are getting out there. But as we are doing our work, it is also very important to remember that these are sensitive issues, so we need to be sensitive. But as we are being sensitive, let's avoid over-censoring ourselves. We must always seek facts, present them properly, and avoid, losing facts in the course of doing our work. And let knowledge and facts lead, but avoid our emotions We could have understood certain things based on our cultures, but we should avoid, when we are presenting them in this context, having our emotions leading the way. Let the facts, as we have gotten them from experts, be in the lead. And remember that we're dealing with people's lives here, and therefore we must always avoid hating in the way we are presenting our stories, and never be part of people that raise false hopes. There is all this talk of miracle cures and herbs. We have a role of ensuring that we are not part of those that are presenting the falsehoods and for raising false hopes. Instead, let's exchange hope and ensure that our people are well informed of how best they can get help when, for example, they've got issues around infertility, they've got diabetes, they've got high blood pressure, and so on and so forth. Because that's the only way we are going to be a saving function of a society. And of course, let's remember that we're dealing with people, so confidentiality of people's situations and conditions, and that of their families, is very critical. Otherwise, we'll end up hating instead of helping them understand these things and therefore be able to do things right. And as I finish, again, I get back to thanking you all for listening, and of course, thanks Merck Foundation, Media Council of Malawi, and the First Lady's Office for coming together to organize these sessions. They are very critical for our media as a community. We have a community of media in Malawi, which is currently generally young, because a number of experienced professionals have left the newsroom, and the newsroom has been left in the hands of people that require a lot of such knowledge for us to be to practice journalism ethically and practice journalism that is going to be helpful to our society. Thank you.
Now the floor is open for questions for our esteemed speakers.
Okay, I want to know from you, how are you working with community legislation in Malawi? Just because many issues which you have said, it is concerned about women. So this legislation is based in the rural area. So I want to know from you how you are working with community legislation in Malawi.
Yes, I think she was talking about the issues of infertility, and to what extent are the conditions, especially in both women and especially in women rather, to what extent are the issues of infertility corrected? Are there some conditions of infertility that can be corrected, and what conditions or what extent can they never be corrected? Because I'm looking at the issue of presenting or inspiring hope to the people. So there is need of actually presenting them in a manner that indeed inspires hope. So to what extent or what conditions are really are we able to correct infertility, or maybe they're just that infertility that is completely not something that can be corrected?
Okay, thank you for that question. Yeah, so maybe I should start with saying infertility is a condition that can be treated. The treatments vary depending on the cause of the infertility. So let's say, for example, the cause is exposure to toxins. All you need is advise this couple to avoid those toxins, and usually then that will improve their fertility. There will be other situations like I'll talk about the commonest cause of female infertility, which is the blocked tubes. If the tubes have been blocked, there is treatment that can be offered. Even though we are not able to offer that treatment yet in Malawi, maybe in the future, it will be, they can get treatment by what we call in vitro fertilization, in short, IVF. This can only be done outside of the country as of now. Now, there are also other easily treatable causes, such as ovulation dysfunction. So we are able to provide ovulation induction medications right here in Malawi. And following the training that Merck Foundation provided for me and some of my colleagues, we are able to offer intrauterine insemination for those patients where the tubes are okay, but maybe it's a problem with the, maybe some slight problems with the semen, and we see that the intrauterine insemination is going to be beneficial. So yes, it can be corrected. Not all causes can be corrected. The most important thing as we sensitize the masses is that they get to be evaluated, and this evaluation should include both the woman and the man, so that we can identify the cause and advise them accordingly. In the event that we are not able to offer treatment in Malawi and they cannot afford to go outside the country, we do provide counseling and what are the other alternative treatment options that or other options of having children that are available. So we do need to encourage people to get to be evaluated, so that the cause is identified, and therefore then they can be taken through a personal counseling journey. Thank you. I hope I've answered that question.